think we're ready to get started. I want to welcome everyone to the Civic Design Center's May Urban Design Forum, entitled Adapting to Health Emergencies. My name is Gary Gaston. I'm the CEO of the Nashville Civic Design Center. And on behalf of our staff and our board and our organization, I want to thank you all for joining us tonight for this program. The past month was the 4th anniversary of the release of our book, Shaping Healthy Communities, the Nashville Plan. A lot of factors influence what makes a healthy community, from encouraging the use of public transit, physical mobility, to healthy food accessibility, the access to different housing types, and open spaces. Due to the COVID-19 outbreak, more factors have been brought to light, like safety of our homeless and vulnerable populations, and whether or not air pollution can further impact the susceptibility to the virus. So we wanted a chance to invite local experts and national experts to join us for this forum to further discuss this. And we also know that health emergencies can be further exacerbated by natural disasters. Tennessee was doubly impacted, first with the tornado and then with the Chattanooga tornado, as well as COVID. The people who experienced damage or loss of power to their homes have been in vulnerable situations, in addition to enhanced by the outbreak. On Wednesday, May 27th, we are excited to welcome back to Nashville virtually the co-author of Shaping the Healthy Community, Christine Kreyling. And welcome back, Christine. You're in California now. It's great to see your face. Christine will be helping moderate this discussion with our experts here, and I'm very happy to be joined by, we have here Leslie Meehan with the Tennessee Department of Health, Dr. Sammy Areola, who's the former health director of Metro Public Health and has now moved to Johnson County. We have Ed Henley, principal at Pillars Development, and Eric Hoke, and they will be doing an introduction. But first, I'm going to attempt to, actually, we're going to switch to introductions now. So Leslie, could you give a short introduction to yourself and let us know how you're doing?
Sure. Well, thank you so much for having me. It's a pleasure to be here today. I'm Leslie Meehan, and my background is in land use planning and transportation planning. I've been with the Tennessee Department of Health for about 5 years, and we have a focus on looking at the built environment for opportunities to improve physical, mental, and emotional health in Tennessee. It's a pleasure to be here. NCDC is a longtime partner of ours, and very excited to talk about some of the national trends that we've been hearing about.
Great, and how are you doing? How are you holding up? What's your...
I am very glad that school is out. I have 2 school-age children and a 1-year-old, and working full-time with my husband working full-time with 3 small children at home was quite the scheduling feat, but I'm happy to say that we made it through. And we're just happy to have summer here and have a little bit of a break.
Okay, great. Dr. Areola.
Hey, thanks for having me, Gary. Good evening, everyone. Sammy Areola spent a little over 17 years at the Nashville Public Health Department, moved to Johnson County, Kansas, about 2.5 months ago, beginning of March. And I've been engrossed in a response to COVID-19. As a matter of fact, driving down on Monday, March 16th, planning to start a week after that, I got a call and said, "Can you start tomorrow?" And so, and that's all I've been doing by training. I'm a toxicologist, environmental toxicology, and but my work has been largely around public health. And my message is pretty simple. We know the things that work for health. Having adequate and appropriate housing works for health. Not being very, very poor works for health. And so all of those factors allow us to define health broadly. And I think for us to move forward, is to incorporate those assumptions into our policy and decision making so that in 10 years time we'll be a lot better than where we are. Where we are now is a consequence of our decisions 20, 30 years ago. And so I will be bringing those things in to talk about the impact in terms of prevalence of COVID-19 in the population and among ethnic minorities, among our most vulnerable populations. And so I'm looking forward to talking with the group. How am I doing? I moved to a new county just when the shelter in place started. And it's been several hours a week and every day. And so I still don't fully know the cities and the county very well, but I'm doing great.
Great, thank you, Dr. Areola. Ed, are you on there?
Yes, so Edward Henley, principal of Pillars Development, local land use planning and development firm here in Nashville. I've worked to help build the city over the past few years and had the pleasure of working on some of the large civic projects and open space projects. Also an esteemed board member of the Civic Design Center, so happy to join and further the conversation this evening, as well as a representative of the Public Development Infrastructure Council for ULI Americas and the local ULI chairman of mission advancement. How am I doing? Our development firm has grown over the past 6 years to a team of 10. So really understanding the dynamics and the impacts of the projects that we're on, as well as the team and how we've all been affected. It's been another full-time job, as well as still working through some of the projects that we've had going. Construction and construction-related activities were deemed essential, and so that has kept myself as well as my team members quite busy, which is great. We've also had to deal with some of the things that everyone's dealing with, such as team members having to deal with children and having to deal with altered daily routines. But all in all, no complaints. I try to take everything as an opportunity to learn. And, it's been a lot of information from a lot of different sources. And I think that's been one of the challenges, but also one of the things I've appreciated the most during this time. And hopefully I can bring a lot to the conversation this evening based on those things.
Great, thank you, Ed. And Eric, you want to do a quick introduction of yourself?
Yeah, sure. I'm Eric Hogue, the design director at the Nashville Civic Design Center, and I've been with the Design Center about 8 years. And actually, one of my first projects was to help with visualizations and renderings on shaping healthy communities. So I'm really excited to be a part of this conversation here today, kind of circling back to it. And as far as how I'm doing, I just had a baby on the day of the tornado, the morning of, and so just kind of adapting, for all that stuff at home with my 2 girls and my dog and my wife.
Thank you, Eric. I do want to, before we get started on the presentations, if people who are in the audience, we will be having question and answer session. And if you will submit your questions into the Q&A box, we'll be monitoring that for questions towards the end of the program. So with this, I want to beg from everyone, please, with my technological services here momentarily, while I switch over to PowerPoint. So I want to do a short overview of the Shaping Healthy Communities process, which gives us the framework for this program. You know what? I'm at the wrong point in that. So this is, as was mentioned, the 4th anniversary of the release of Shaping Healthy Communities. The Nashville Plan was in April 13th. And look at that, Christine. Look at us 4 years ago. After about 4.5 or maybe even 5 years of research and study that went into the process of creating this publication and this book, which was initially inspired by the work of Dr. Richard Jackson, who was a doctor who's working with the Centers for Disease Control and Prevention, And he switched lanes from, well, he was focused on childhood obesity, and then he veered into the role that the built environment plays in public health. And we built on some existing studies at the time that started to look at the transition from, or actually the role that planners and designers can have with the public health community to begin addressing issues that were quickly and fastly escalating obesity rates across the United States. And as you can see from these maps, a large focus of that dramatic increase in over 30% obesity rates are concentrated in the southeastern United States. And so that was actually, this was a grant process through the Centers for Disease Control, and Nashville received a grant through a process called Communities Putting Prevention to Work. And we actually approached the Nashville Metro Public Health Department with a grant proposal to look at Nashville and study the impacts of the built environment related to health in the city. And this is just a chart showing how our rates of obesity in the state of Tennessee, when combined with overweight, are nearly 70%. And that was from the 2010 rates. Another thing, and I hope that Dr. Areola will talk more about this, was starting to look at the correlation between public health and the most vulnerable zip codes and areas of the city, and how city services, as well as the focus of city public health dollars, as well as infrastructure, could be put into the places that had the highest health discrepancies. And this is a map showing the percent below poverty rate, as well as overlaid with the dots that show the premature mortality rate. So you can see how those correlate together. As we were just discussing with Christine, this phrase, "the shape we give our city in turn shapes us," I really love this image. I use it in almost every presentation I give, showing how much different Nashville is, the same city, but about a 100-year time frame difference. And we can see how we can shape cities to make them healthier places over time. The historical reference here was the way that planners and public health officials worked together to solve health problems that were related to this built environment. Very dirty cities that were spewing toxins out into the sky. Things were being dumped into the rivers. There was a lot of infrastructure that went into changing this. And the city of today, we are still, while vastly cleaner, we're still experiencing a lot of health inequities. This is the built environment that we have created in cities all across the country, not in any way specific or unique to Nashville. It's actually very similar scenes can be found almost anywhere in the USA. That's why it's referred to Anywhere USA. There are built environment factors that have led a role in our cities becoming unhealthy places. And the Shaping Healthy Communities book began a process of looking at that, and as well as places that actually do promote better, more activity and getting out and walking. And I think I know we'll talk about how much more people are out currently during COVID and getting out and utilizing those assets and resources that we have. And as well as people that are probably much more conscious now of the lack of access to those resources. So the book is actually, we address 6 different physical built environment factor groups that play a role in impacting our public health. The first one of those is, what is the neighborhood type that we live in? And I'll elaborate that on following slides. What are the different types of access to transportation that we have, from the automobile to public transportation to cycling, And then we actually created a different group specifically for pedestrian walkability and safety, because that is so important for us as individuals. What types of access to food resources do we have? What are the different types of housing that we have available to us? And what are our open spaces and parks look like? And I won't go into that, but we looked at all of Davidson County and how different areas of the city are classified as the different community types that we have. And just to briefly review those, these are community types that happen all in places all across the country. We have unbuilt natural areas that have no development on them. And this is Radnor Lake, Radnor Park in Nashville, but we have other large parks that are undeveloped. We have in the city of Nashville, in Davidson County, we still have very rural areas, and notice the type is not on here for that one, but that was a rural community. We have suburban communities, which are mostly post-World War II development patterns, and they're based upon the automobile and primarily single-use zoning, which we can talk more about. We have urban neighborhoods, which are have streets and grids and alleys. We have centers, which is a density between an urban neighborhood and the downtown core of the city. And the one outlier of that catches everything else, like universities and factories and the airport, those in the book are just classified as districts. So that's the way that the book was divided in chapters, and each chapter goes into the ways in which you can take the existing conditions and the history of those community types and over time start to transform them into healthier places that are more connected and with transportation and open spaces and better food access and better pedestrian safety. So that's a quick overview of the Shaping Healthy Communities book process. And I'll just say, following the book, we began doing implementation work, and we created a neighborhood assessment toolkit that allows us to work closely with developers and other neighborhood groups. And I know Eric will have a little bit later in the program further information on that. But at that point, I want to hand it over to Christine Kreyling. Give us an introduction, Christine. It's been a little bit.
I'm Christine Kreyling. I'm an architecture and urban planning freelance writer. I worked for many years in Nashville as the architecture and urban planning critic for the Nashville scene, and did a lot of work with the Design Center, particularly on Plan of Nashville and Shaping Healthy Communities. I currently live in the northwest corner of Sonoma County in Northern California, right across the river from Mendocino County. This area is very rural. So I live in a planned community that began in the 1960s called the Sea Ranch. It was planned by a bunch of, Lawrence Halpern, and was the lead landscape architect. And there were a bunch of other architects from UC Berkeley and in private practice in San Francisco who came up here and took, it's basically, there's like 1,018 building sites, something like that, and 2,500 acres of commons land. So it's the idea behind it, although it's not been universally implemented in this way, but Halpern's original idea was that buildings be clustered together, surrounded by common space. And I live in an area called the clusters that's just like that, small houses with very minimal footprints and almost no yards, but lots of common space, which means I'm doing pretty well in terms of the pandemic because I can get outside and hike on trails all the time. We're obviously low density because it's rural. I'm able to see my neighbors and friends who come over because we can go out to the meadow that's right outside and socially distanced. We can sit 10 feet apart from each other and everything. So except for not having any house guests and not having to clean my house as a result of that, I'm doing fine. Okay, so you want me to What I'm supposed to talk about today, just to start things off, Gary asked me to speak a little bit about history and to kind of jump through history and the built environment, however odd those relationships may be in terms of pandemics. COVID-19 isn't the first pandemic the world has faced, and it certainly won't be the last. In recent decades, epidemiologists have been warning with very little effect of the potential, noting SARS and MERS before this. Today, they're warning that even if we get a vaccine for coronavirus, we'll still be at risk for subsequent viral explosions. So considering how COVID-19 may impact urban design, architecture, and planning is a good topic to study, not only to respond to the current crisis, but to plan for the future. The question is, how can these disciplines help prevent or mitigate the spread of the disease, or at a minimum help us live with viral disease? So here's a little history. According to an article by Elizabeth Colbert in the New Yorker, the first known pandemic began in Egypt in 541 and spread to Constantinople, Rome, and across Europe and the Near East, with successive waves and recurrences until subsiding in 750. Historians credit this plague with playing a substantial role in the fall of the Roman Empire. In any case, the impact on the city itself was pretty obvious. The population of Rome fell from 1 million at its peak to 30,000 people. Talk about adaptive reuse. That was definitely an occasion. The first building intervention in response to the bubonic plague that began in Europe in 1347 was the construction of facilities for quarantining. In the 15th century, the Venetians placed those who arrived by ship in isolation wards that they built on outlying islands. They then aired out the ships for 40 days to dissipate what they thought were plague-carrying vapors, the so-called miasma theory of disease. This theory stated that bad-smelling air was diseased air, infected by earthly decomposition. The theory was off, but the results were positive. In 40 days, 40 being in Italian quaranta, so that's where you get quarantine, the plague killed off the rats and their fleas that carried the disease, as well as all the infected passengers, unfortunately. Much 19th century public health theory may have been misguided based on the evils of imaginary fumes, but it had beneficial outcomes nevertheless. To improve air quality, the smell of air, in other words, cities opened up with parks and boulevards. Haussmann's plan for Paris was designed to provide military control of anti-government forces sequestered in the cramped, irregularly planned medieval quarters of the city, but the plan brought light and air into the city as well. Miasma theory was also a big influence on building materials, according to a guy named Christophe Linteris, who's the co-author of a book called Plague in the City. This is a quote from him. The craze for paving streets with flagstones was largely driven by sanitation logic and a desire to seal in the earth's poisonous gases. It was thought that disease could permeate through any structure in direct contact with the earth, so walls were sealed at the surface and buildings were increasingly coated, clad, plastered, and varnished to form a shield against the invisible enemy in the ground. Once the rat, actually the rat's fleas, was identified as the main carrier of plague, all attention turned to safeguarding buildings against rodents. Every city in the world suddenly had committees of engineers trying to devise ways of rat-proofing, Linteris says. It was a global craze, spawning thousands of patents in the 1910s and 20s, from drain pipe guards to concrete barriers. In contrast to plague and smallpox, which made few class distinctions, cholera, which is spread by contaminated food and water, was really a phenomenon of the urban slums. During the 19th and early 20th centuries, life in cities was dangerous to health. A majority of the population, especially the poor, lived in crowded, filthy conditions. There were no building codes to ensure safe and healthy dwellings. Sanitation systems and clean drinking water were largely non-existent. This led to repeated epidemics of cholera, typhoid, yellow and scarlet fever, diphtheria, and smallpox. Those with the means to escape, at first a horse and carriage, later streetcars, moved to villas in the suburbs. Frederick Law Olmsted, the hugely influential landscape architect and park planner, was a sanitary engineer in the Civil War and subsequently chair of the American Public Health Association's Committee on Sanitary Values and the use of shade trees, parks, and forests in planning. For Olmsted, open space and access to nature via parks and parkways were preventative tools for physical as well as mental health. The association of congestion with ill health was a major factor in his design with Calvert Vaux of the suburb of Riverside in 1868. It stood outside Chicago and was a very early example of suburban planning. Public health officials, meanwhile, tried to improve conditions for those who remained in the city. Now remember that air smelled bad and was diseased air. Therefore, the idea was to make air less smelly. Streets as well as interiors were to be sanitized. People were urged to bathe and wash their hands. Garbage collection and disposal were instituted. Livestock removed from cities. They used to use pigs to eat garbage in the streets in downtown Nashville before garbage collection started, and you can imagine how that smelled. So, and other measures such as that. It's true that density did exacerbate the spread of infectious diseases, but the cause, just as it's done with COVID-19 in New York, for example, but the cause scientists eventually discovered were microorganisms, the germ theory of disease. Sanitation and immunization were the answers. Sewers and sewage treatment came along with clean water reservoirs. Pipes were laid under these widened streets like the boulevards of Paris. Before this, Nashville's poor, for example, got their drinking water from streams into which their outdoor privies fed. The sanatorium movement for the treatment of tuberculosis was also influential in design. Before the development of medications to treat the disease, treatment was environmental, just as what we're doing right now before we have a vaccine for COVID-19. Those infected were isolated from the general population in buildings, much like the Venetians had done, although certainly of healthier design by this time. By the early 20th century, scientists knew that the tuberculosis bacilla carried in droplets could survive in household dust and remain infective for long periods. Housing for patients, a famous example, Palermo Sanatorium, was designed by Alto, featured plain white surfaces where dirt was easily perceived and removed, the opposite of the Victorian interior. Patients had ample exposure to light and fresh air. These clinical environments inspired modern architecture. Corbusier, the Villa Savoy, for example, who said that a house was only habitable when full of light and air. Minimized adornment, millwork, heavy carpets, ornate furniture that would catch dirt, all those were sort of taboo. The pandemic known as the deadliest of all was the so-called Spanish influenza, which probably originated in the United States. Then as now, there was a strong tendency to blame outsiders, as they're doing today by coining the term the China virus. This pandemic saw first and second waves in 1918. The second was actually by far the deadliest, before fading away in 1920. The death toll estimates range from 21 million to 100 million in the world. That wide range is due to uncertainties of record keeping in governments at the time. And keep in mind that was in a world with 1/3 of our current population. I find much evidence that the great influenza, the Spanish influenza, had significant impacts on urban design, although it perhaps accelerated the desire to move to the suburbs and enhanced the design of individual buildings as clean, well-lighted spaces. If you go back in the 1920s and look at interior design, that's when white painted kitchens and white tile everywhere and all that stuff really came in. What's interesting is how this great influenza pandemic contradicts the current tendency to put public health and safety at odds with a healthy economy. The cities that shut down quickest and hardest and stayed with it longer recovered economically faster and more robustly. In an April article in the New York Times, the authors reported that, for example, Minneapolis locked down earlier and more stringently than its sister city of St. Paul. Minneapolis ultimately emerged with a stronger economy, employing more people. Across the United States, the coronavirus has amplified the traditional sort of divide between town and country, with some Republicans blaming city dwellers, who are more often Democrats, for spreading the disease. Density is still a pretty fraught subject for us because of our long tradition of Thomas Jefferson and wide open spaces and open country, and Monticello on his own little mountain and such. The pandemic therefore gives ammunition to people who are naturally skeptical of density and want to promote car-centric suburbs. But obviously there are aspects to car-centric suburbs that shaping healthy communities, as Gary just pointed out, are threats to health as well. And so how we want to treat suburbs if densification or a reduction in density needs to happen, or inevitably happens in downtowns. We need to retrofit suburbs in much the way we talked about in shaping healthy communities, so that they are not bringing about different health challenges. Many urbanists, however, are skeptical about how much coronavirus will actually change anything. It depends on how long it lasts and how many people die from it. But in the meantime, I think it's good to consider not only, as I said, how we respond to this in terms of response to a crisis, but how we use this as an opportunity to plan better cities and suburbs and rural areas for the future. Thanks.
Thank you, Christine. That's really wonderful, fascinating history of pandemics. And I know we'll talk more about that. Leslie, you are first to go with giving us a presentation of the work that you're involved with.
Great, thank you so much. The beginning of my presentation. And all right, there we go. I don't think we could have had a better introduction than Gary's remarks and Christine's remarks both. And what I wanted to share today are some of the conversations we're hearing at the national level in several different sectors. And if I could sum it all up, I think what we're hearing is that several sectors are having a moment. They're pausing, and they're realizing that the work that they're doing that they may have thought previously was perhaps tangentially involved to health, in health, is very much involved in health. And I think it's an incredible opportunity, and in fact, you'll see that theme through the slides, for many sectors to think about the way that they go around about their book of business and the conversations they're having with other sectors and how those conversations are influencing our health. I think one thing that we all can agree on is that health matters. And for many of us across our country, we're realizing a few things. One is that the coronavirus can impact anyone, any age, any demographic, and that levels the playing field, if you will. I think one of the reasons that we oftentimes see in a pandemic like this, or an epidemic like Zika virus or Ebola, we see elected officials not hesitate to put money behind something. And I think the reason that is because they recognize that the pandemic or the epidemic, the infectious disease, can influence really anyone. We see the same type of response after a natural disaster like a hurricane or a tornado. And so this is really an opportunity for those of us who are built environment professionals to think about how do we capitalize, if you will, on the limelight that infectious disease is getting currently, and draw attention to some of the equity issues and chronic disease issues that oftentimes don't get the same amount of attention. And I think we can also agree that everyone is recognizing right now that our physical health matters, whether again we're talking about infectious disease or chronic disease. There are many who are realizing the relationship between underlying health conditions such as heart disease and diabetes and hypertension and asthma, and how those conditions can have a more negative outcome for someone who contracts COVID-19. So we're having that conversation. I think where we could have a little bit more attention is looking into the underlying causes of things like heart disease and hypertension, and how the built environment plays such a strong role in driving those health outcomes for many people. So this, again, I think is our opportunity as built environment professionals to introduce those concepts. And it doesn't matter if you don't have a public health background. I think our role is really just to talk about how walkability, food access, pollution, those kinds of things really influence these underlying health conditions. And surprisingly, many people don't put those dots together. And so that's an important conversation piece that we can all have. But we're also recognizing mental health and emotional health, which oftentimes take a back seat to our physical health. But I believe the coronavirus epidemic has really highlighted the fact that we have to pay close attention to our mental health and our emotional health in order to have all facets of our health be intact. And going back to the picture that Gary showed, one of the most important conversations I think is happening in light of COVID-19 is talking about realities. And not all of us have the same reality. Many of us have jobs where we can work remotely. Many of us do not. Many of us have transportation options. Many of us do not. And so it's incredibly important to talk about how an environment like this, and as Gary mentioned, this is on Charlotte Avenue, it's a lot harder to make healthy food choices. It's harder to social distance. It's harder to have transportation options. And so we really have to think about the built environment and how it influences the choices we can make, both for chronic disease and for infectious disease. And as Christine mentioned, this is an opportunity for public health to go back to its roots. Public health and urban planning and the built environment really started to work together around the spread of infectious disease, as Christine mentioned. And we're coming back to that intersection, I think, in the last decade or so, and it's being catapulted right now. And this is very important, again, for us to capitalize on this. This is our window of opportunity to highlight that infectious disease is incredibly important, but also its relationship to chronic disease and inequity. And so the opportunity for public health is to make sure that we as a profession are thinking not only about the immediate response, which is very much where our headspace is now. We are doing widespread testing, widespread contact tracing, and we're putting out messaging about how folks can socially distance, they can protect themselves with masks and washing their hands. To tell you just how prolific this response is, our entire built environment team is involved somehow in this response. So we have folks that are doing contact tracing, who are crunching data, who are working as lab liaisons, and are processing things like test results that are coming in from the prisons and jails across the state. So this is definitely an all hands on deck moment for public health. But what I'm hoping is that public health will pause enough to realize that the response has got to be greater than controlling the infectious disease, and that we really can't forget about these underlying health conditions. But you see a screenshot of Robert Wood Johnson's Culture of Health model there, and the de Beaumont Foundation's Public Health Reaching Across Sectors. And these are opportunities for national organizations who are encouraging public health to think outside the box and to connect with other sectors. So I'll move quickly just through a few slides. The opportunity for transportation is to think about the way we've been doing business. It's interesting, according to the Tennessee Department of Transportation, the volumes on roadways during the Safer at Home orders were down quite significantly, but they're back up. We're at about 80%, and that may have even grown. in terms of our former capacity. So we have an opportunity to think about those who do have jobs, who could be the jobs that could be done remotely. Do we really need this much capacity on our roadways? And if we take capacity off of our interstates, we can certainly take the capacity off of our residential streets. And if we're able to do that, we can start to think about repurposing what is really a public asset and perhaps increasing opportunities for people to walk or bicycle, or to even have outdoor cafes, things like that. So it's an opportunity for transportation to think about, do we really need to dedicate as much physical space to the movement of vehicles as we traditionally have been doing? It's also an opportunity for transportation to think about transit, and we'll get to some of that in the discussion, but there are some pluses and minuses on the horizon, I believe, for public transportation. So here we have an example of what this can look like. You probably recognize this scene in downtown Nashville. It's a street that's closed down every Thursday for food trucks. And so there is an opportunity to be creative and to think about how we can utilize our public assets. And that's how I like to think of a street. It can serve multiple purposes. It doesn't just have to have one purpose. So for housing, we can also think about the opportunity for density. And as Christine said, infectious disease doesn't necessarily spread because there's a shared wall between two dwelling units, but more so we're thinking about having a lot of people in a small area, and is that going to change? And are those who have the means going to move to a situation like this? Are we going to see a resurgence in suburban sprawl? Because if there is a shelter at home type of order, or if social distancing continues, are we going to see those who have means transition back to an earlier development pattern that we saw? And so I think this is going to be very interesting to see what happens. But then the challenge for all of us as well is to make sure that these are not the only types of housing examples we're thinking of. We need to think of all different types of housing, and those who, again, don't have the option to simply pick up and move. So for parks and recreation, of course, the opportunity is hopefully to advocate for more of them. We've all, I think, become huge champions of our parks in the recent months, and probably many of us have used those as reprieve. But again, we need to think about equity and who has access to those facilities. And so how do we do this safely? We have to start thinking about things like ball fields and playgrounds and other facets of parks. Tennessee State Parks, you may know, closed down for a few weeks simply because they had so much demand, and they wanted to make sure that they were protecting those who were visiting the parks and who are staffing the parks. And so this is unprecedented territory for parks to think about how to accommodate the capacity and the demand. And we're going to have upcoming budget cuts all across the country and at the state and the local levels. And so we probably are not going to have increased budgets for things like parks. And then in terms of physical activity, we know that youth in neighborhoods with recreational facilities are more likely to be active. So we have to think about that. But if our schools don't look like this anymore, or don't look like this full time, then how do we make sure that A, we can provide access for folks so that students can learn remotely? But how do we also make sure that we're encouraging physical activity for those who are working or attending school remotely? And again, we have to challenge ourselves to not think of this as the default mode, that there are many, many students who don't have the ability to be supervised at home or to have access to technology at home so that they can learn on their own. But we do know that kids who engage in physical activity learn better, and they're more likely to earn A's, particularly in math and English. And you can see the images of the brain scans down there, and those are images of before and after physical activity. So the way that we like to talk about the Department of Health is physical activity is as important for learning as a pencil. You wouldn't expect a child to go to school without a pencil. We should not expect children to learn without physical activity. It's that important for how the brain retains information and processes information. So it's incredibly important. And then lastly, as we've already discussed, we can rethink our workplaces. But again, we need to challenge ourselves that we're not believing that every job can be done remotely. Many, many, many jobs cannot be done remotely. And so we have to keep in mind that we need to protect the safety for those jobs that can't be done remotely. And I'd like to encourage anyone who's interested to sign up for our bi-monthly newsletter. It's our Built Environment and Health newsletter, and we include all kinds of resources, articles, grant opportunities and things like that. And we have not only a statewide distribution, but a national distribution as well. So thank you very much.
Great, thank you, Leslie. That was really great. And Christine, any follow-up questions for Leslie?
Well, Leslie's mentioned, and we can talk about this later, but what I've been reading in terms of transportation is, yeah, it's really nice to have the cleaner air and not as many cars. And if we are going to need more open space in urban areas for parks, but also for outdoor dining or outdoor, retail or whatever, that it would be good to take some of that capacity. But there are big questions about public transit, which you alluded to. And I don't care when we talk about that, but that is a big issue because a lot of people right now, the idea of getting on a subway car or a bus with 50 other people is not a desirable prospect. So I don't care.
Well, I think that hits on Dr. Ariola's
Okay, that's cool. That's good.
Well. So let's switch over. Welcome.
Okay.
Share your presentation.
Yes. Thank you. Let's see. Oh, okay.
Right, and you just let me know when I.
Oh, okay. Thank you. You're sharing that. All right. All right. That's good. Good evening, everyone. I thank you, Leslie. Excellent, really coverage of a lot of the factors that are important to health. I past 2 months, I've been engrossed in responding to COVID-19, and I just want to start off by saying one or two things about the virus that causes COVID-19. It's really unlike anything that we have seen before. It's a virus that somebody doesn't even have to cough or sneeze. They just have to be close to you and talk and breathe, and you can be infected. And so, but we're beginning to understand a few things more about the virus. We can go to the next slide. About the virus, and some of those we could predict. Look, it's what we always say. We say that your zip code can be a bigger predictor of your health than your genetic code. And every time that we see that, whether we're talking about chronic diseases or we're talking about COVID-19, they always hold true. Gary showed a few slides there that overlaid the prevalence of chronic diseases with a zip code, and it really doesn't matter what the end point is, whether we're talking about asthma or cancer or whatever, you are going to see the same pattern. And so the predictor of those things that you see are clearly the things that we call determinants of health. Talking about COVID-19, here, our data here in Johnson County is really reflective of what we see elsewhere. Data from Chicago, Detroit, other places. It is no doubt disproportionately impacting communities of color, as well as our other vulnerable population, people that are older than 65, people that are in long-term care facilities, nursing homes, memory care, independent living. That's where we are seeing a lot of the deaths come from. In Johnson County, for example, African American population is about 4%, but they represent 12% of our cases. And that's, again, what we are seeing. And so there's no question that there are substantial racial inequities, not just in the rate of infection, but also in the rate of death. Like I always say, if you're poor, your health is poor. And when you define poor, these are typically communities that are predominantly of ethnic minorities. And these are the same group that are disproportionately impacted. I say that we could predict some of this outcome, really, if depending on the mechanism that you choose to believe in terms of how COVID-19 is impacting the human body. or if you look at some of those some of comorbidities, whether it's heart condition, diabetes, obesity, those are conditions that we see that are almost always correlated negatively with income level, and definitely always higher with poor people and with people of color. And so if those are the predisposition factors, it's not rocket science to see why the impact is felt. I'm not sure that the infection rate is necessarily higher. It could be in some cases, but the impact, the adverse consequences are no doubt definitely more adverse in these communities. Next slide. Okay. And so okay. And so the question to us then is, this is inequitable, and let's kind of talk through some of the why. Nothing new. Let's go to the next slide. And so we're going to look at this in 3 different ways. I think Leslie covered some of them. Is look, we know what works for health. I was having this same conversation with the new administration in Nashville before I left, and my argument remains the same, that if we are not going to change the policies that got us to where we are, then we're going to keep seeing the same thing. That we cannot stand at the end of where the water is flowing and keep mopping the leak. We've got to go upstream to fix the leak, and that means that we have to get into how we distribute our resources. It has to get into our budgeting process. If you want me to be physically active, then make sure that it's convenient for me to do that in my community. Make sure that there are sidewalks there. Make sure that policing doesn't negatively impact me. Make sure that I'm not scared when I see the place. Make sure there are no dogs running around. Those are factors that until we get into those places, we're going to continue to see the same disparities. We're talking about built environment. We already know Leslie did a great job, and I'm going to get into some of those things. Think about it. We talk about shelter in place. We talk about essential workers. Who are the essential workers during this crisis? These are people at the low end of the socioeconomic status. These are ethnic minorities. They are the ones that are driving the buses. They are the ones that are working in the grocery stores. They are working in the restaurants. They kept the economy going while shelter, safer at home was ongoing. And so, and when you see the design of testing program across the country, it really does not take those people into consideration until much later. We had obviously sample collection devices, swabs, and other resources were very scarce when we started. And so they were prioritized towards high-risk hospitalized group. So, but here eventually, if you are not sensitized to the concept of equity, you are not going to develop a plan or a testing plan, a program that takes those into consideration. Eventually, that's what we did here. We targeted those groups. We targeted our ethnic minorities and oversampled in those populations to get a good picture of what's going on in the county. And so equity, again, it's at the core of what we do. It's an end by itself, but more importantly, it's a means to an end, meaning that for everything that we want to do in health, what we do in public health is look at data, look at where the gaps are, and try to target interventions and resources to fill the gap. So we've seen this for so many years, but for some reason, we have been very reluctant to put our money where our mouth is. I'll go to the next slide. And so, so some of the gaps, a lot of them, just think about it, related to COVID-19. I've talked about gaps in testing. Unless you intentionally understand that there are groups that are more susceptible for different reasons, some because of age in nursing homes, some because of a generation of inequities. And again, you have to target those people to understand and get a full picture of what's going on. If you talk about access to healthcare and health insurance, minorities, susceptible people at the low end of the socioeconomic status are less likely to be insured or adequately insured. They're also less likely to receive the appropriate care. It's a clearly commonly understood concept that when we were struggling for ventilators, if we ever got to a point where we're making a decision between who gets what, minorities are going to be on the short end of that. And in terms of the consequences of shelter in place, I think Leslie talked about that. Transit, if buses are not running, if I live in a community where I don't see a lot of buses anyway, think about certain parts of North Nashville, and you asked me to shelter in place. For me, the picture that it brings to mind is the picture of Katrina in New Orleans, when we say, people, you need to evacuate. If I don't have a vehicle, if I don't have money to buy gas, if I don't have money to pay for a hotel, you can tell me to evacuate as much as you want. Those challenges are going to be there. In terms of the consequences, evictions, they're more likely to suffer those. They're more likely to be late on mortgage, and the impacts of layoffs and follows. Here we've been telling people, hey, telework, work from home. They're less likely to be able to do that. Homeless population, impacts of school closures, food childcare. We got to think about all of those things as we evaluate all of the consequences in our community. Next slide. Okay, and so this is really where that's my last slide, and that's again learning from where the gaps are, and really zeroing in on the disparities and equities as we reshape our assumptions in redesigning where we live, in redesigning our built environment. It's very important that how well the assumptions that we make, or the assumptions on which the decisions that we make are based, how close they represent the true situation is, to me, by far the most important thing that we need to work on. If we are building, and I see all of those beautiful pictures, okay, you've got to factor in cultural differences. You've got to factor in spatial racial distribution. You've got to factor in socioeconomic status. A lot of the good design that we see happens where people are well educated, where people make above average money. And so we've got to modify those, in my opinion, to fit the different cultures that are there. And how do you do that? How do you refine your assumptions? How do you make your assumptions better to reflect the true situation? It is by working with the people in the community. So we've got to engage them. And I agree absolutely with what Leslie said. This is a candid opportunity to do that. It's a good opportunity to review our processes, to review our preparedness processes, to review our planning processes. When we are doing our after action reviews, which there'll be a lot of it, it is to make sure that we engage people from all of these sectors. Look, I was in Nashville for 17.5 years. When you get when you're at the table, you see the same set of people. And a lot of us are some different distances removed from these communities. It doesn't mean that we have nothing to offer, but we need to engage people and make sure they are at the table. That's the only way to get to where we are, and to fairly and equitably get to where we need to be. And so we need to invest in all of these factors. Budgeting in the county needs to reflect. Here's what the mayor in Nashville was saying just before I left, and just before COVID-19 came in. He said, and he said that publicly several times, that the net worth of Nashville was at $103 billion. Okay, and it has grown about 36 billion in the last 3 years. The entire net worth of Chattanooga was 18 million, meaning that in 3 years it has grown double that of Chattanooga. But in terms of per capita household wealth for the white population, it was $257,000 to $7 for the African American population. So it is rich. If your per capita income is $7, your health will be continuously poor. It really doesn't matter what health education you push. And that's why when I look at health education, and people know that I say that a lot, I think we are beating that to death. What we need to do is go to the root causes, invest in transportation, invest in sidewalks, invest in the community, put in resources where people can walk. If you want me to eat healthy, make sure that I have groceries there that will allow me to do that. If all I have around me are fast foods, that's what I'm more likely to eat from. And so again, Gary, thanks for having me. Excellent presentation, excellent opportunity. Let's do it.
Thank you, Dr. Areola. I'm so happy you were able to join us, because so much of your, when we actually did start working with the health department, we were engaged in that process together, and it's been a pleasure working with you over the last many years. So we'll hope to continue the conversations. And I think a lot of what you said, it's both a learning process for cities that have gone through the history of the bad planning that happened, and which added to and built and created the mistrust from the communities in which are so really need that have the health disparities and are trying to make change. So it is definitely an effort that everybody has to be engaged and involved in, and always continued focus. Ed, turn to you. What are you hearing, seeing, happening? What's going on with you and things related to development in the environment right now?
Yeah, absolutely. I think, well, one, I believe Leslie said in her presentation, I think it's a great analogy. I think most industries and people collectively are taking a moment. They're taking a breath. And I think largely it's to not make a lot of knee-jerk reactions outside of course, what you have to take in terms of preserving public health. But in terms of practices, I think, we're, and rightfully so, and I'm glad this is the forum for this type of conversation, but health is again at the focus of just about every industry. And I'd like to touch on a few of those things and kind of talk about the trends that are somewhat reactive or reflective of the conversations we've had here. And I'll start primarily with public facilities. I've had the pleasure of working on a lot of the large public facilities and ones that are currently, some of those that are being utilized as shelters for those here in the city of Nashville. And quite honestly, it's taken a new aspect around facilities that are not serving their primary purpose. And I know, we're in a sports crazy world. Being in the South, of course, we have our coliseums and we see those on Saturdays and Sundays filled with people. But also, very similar to what Dr. Areola said, when you have a natural event, something that really is impacted by Mother Nature or some force of nature, you kind of already have plans. We were impacted by a tornado. We have been impacted by a flood. We talk about New Orleans and how they were impacted by a flood and evacuation. And facilities usually have protocols and cities have protocols. And Nashville's been a city that's taken a lot of initiative on, developing plans around certain catastrophic or weather events. But now epidemic or pandemic level events are becoming a focus for public facilities. I had the pleasure of being on a call with the head of facilities for the YMCA in Toronto, which is one of the largest YMCAs per capita in terms of how many people they serve. And they're talking about their plan and strategy around reopening. And again, around the taking a breath of, well, how do we continue to provide the service? We, of course, want people to be healthy. We want people to be active. Yes, the city, like most cities, have had people go out into their neighborhoods, their communities, and be active. But when you have public open spaces that are somewhat restrictive, but not being, administered or mandated in a way that ensures public safety, how do these private or quasi-private facilities operate? And it's just been a much more intensive process than anybody would think about when you just think of a tornado or a flood. You pack as many people as you can in, you make sure they're dry and they're fed, and that's kind of it. And this is a completely different approach, not completely different, but a significantly different approach when you think about airborne illnesses. And then also they have to think about going forward, not just what they do in the moment, but going forward, how do they manage how they welcome people and how they move people, not only in gyms and facilities like that, sports facilities, but also convention facilities, right? I had the pleasure of working as part of the project team for the convention center, and you have an industry that's pretty much ground to a halt, as well as the hospitality industry around it. And so you have these mega facilities that were built for one purpose of convening people. And we have a pandemic that is now in place that's social distancing is the mandate, right? And you have hospitality and choices that come on with that. So I think public facilities are working and trying to navigate how they best manage the influx of people. How do they scale down, and how do they also make sure that safety is a critical factor, and educating the population and having somewhat of a wardenship over people that is usually something we've become accustomed to not having, right? We want less of that, but the responsibility they understand is in their hands. Another area I think is heavily being scrutinized is retail for several reasons. But I think, and I believe it was Leslie's presentation that showed the food trucks here. I think Austin's food truck and walk-up scene is one that's being taken a look at as a model for how social distancing can take effect, where people are still able to have some sense of normalcy, right? You have open air, the ability to spread out, and you don't have the infrastructure demands or the large retrofitting of spaces that you might think about in a restaurant, or just kind of the closed tables and distancing. But people have the ability to walk up, spread out as needed. Yes, you can have, you probably need to have sanitation stations, but those are things that are being highlighted from a retail standpoint, as well as the walk-up model and the limited amount of people being admitted to or accepted into retail spaces. But that's also being counterbalanced by a lot of the things that are happening where we are truly in the delivery economy, and that's being expanded upon. And I think, outside of other factors that we're talking about in terms of interaction, I think around retail and the desire for people to have goods, you're going to experience now an acceleration in the technology and the interaction of humans with technology. It's a big component now around, minimizing when you have the need for humans to get goods, which is not going away, and their ability to go and get them themselves being hindered, as well as you have a desire to minimize human interaction. You're just basically making a case for an advancement of, automation, and then of course human interaction with robotics, and greater comfort or an acceleration of that comfort. And so you will eventually get to a point where we're seeing more and more and more of that become the norm. And it's actually going to be something that's preferred by people. When we, of course, have talked about the human experience and wanting to have one-on-one conversations in that element, we'll have a craving for it. And of course, we will try to return to normalcy as much as possible. But those are things that are going to forever be impacted and changed, just like we're having these conversations now virtually. People's comfort levels with that are just going to intrinsically go up. Other factors I think are really important to talk about. Two areas, I guess I'll say, that are somewhat nebulous right now. And I say that not to, alarm anyone, but I think it's just truly because people don't know what the approach will be because of the human element. We talked a lot about equity, listening to Dr. Areola, but largely the human element related to choice and the options that they have, as well as the economic factors that impact both hospitality and office. Hospitality, I believe there was an article that talked about the time is now for the positioning of travel for natural wonder, right? Outdoor spaces. When we had started to see more and more and more of the influx, Nashville had been a benefit of it, right? The urban areas that have the great cultural cities, and, as much as you can do in the short of distance as possible, Las Vegas and the Strip, everything crammed in. But now areas and the Denvers, the Jackson Holes in Wyoming, the Northern California areas where you arrive, but your destination is the great outdoors. And so there's a lot of positioning around how those areas may become much more desirable as people still seek to get away, but that's an alternative. Office, of course, is being reimagined. There's some pretty serious conversations about, is open office dead? And I think the answer to that is no, but definitely dense open office is being rethought. And there will be a lot of endeavors to really rethink or I guess peel back a little bit of the movements that were pretty heavy going into the back end of this decade around collaborative space, densifying of space or utilizing less space with more people, I think you're going to trend towards the same less space because people now can work remotely. And just collaborative spaces will look a lot differently, or much more of a virtual interaction that can happen when few people are in an office, in a dedicated office, and so many more people can interact virtually. You know, I also would be remiss if I didn't highlight, you know, residential and multifamily. We talked about the densification pieces of things. I think most immediately some of the changes, or I guess adjustments that are happening are, you know, you have the smaller, tighter, more dense spaces have kind of been the push, and the urbanization push. I don't necessarily see people going against that per se. I think the economy will have a large impact on that in a little bit more of a longer term, because those spaces are usually based off of, one, the people who serve the local economy in that area, or the people who are clamoring for that. And if they don't feel safe in those environments, you will see a reduction in their desire to be there. But just some of the design changes that I think are happening, more elevator banks and things that are actually underway are conceptualized. Work nooks are becoming a standard. When you think about these smaller micro units or things being more clean and more simple and less cluttered, I've seen somewhat of a resurgence in discussion about pantries, right? You know, people now are going to, you know, stock their pantries a little bit more than they may have in the past. And so small tweaks like that are happening, as well as amenities changing. You know, the fact that there was, you know, these communal spaces and a lot of focus on communal spaces was a big deal. I think they're still going to happen, especially those that are open air. But I think the spaces in multifamily that continue to absorb more and more space have been, you know, bike storage, bike racks, and things like that are internalized to give people a sense of a more healthy and more walkable and navigable multimodal transportation. But now it's kind of trended more towards package storage, right? So being able to receive, you know, 10 to 15 packages a month for, you know, 600 unit developments, you know, how do you accommodate all of that? And how do you secure all of that? And what technology is there? And are those all now automated lockers with, you know, thumbprint scanners or key codes? I mean, those are things that are really starting to be cost impacted type of decisions. And then finally, before I pass the baton, I'd like to highlight industrial, which I think is, you know, we talked about construction in my introduction and how it was deemed essential, but industrially, the world's had to keep moving. They may have had different mandates, and some have been asked to operate at different capacities, but I think they're the best suited to transition into what we can consider whatever the new normal may be, largely because they're designed and built around safety, but usually due to liability concerns, not necessarily for, you know, people not getting sick, and then also efficiency due to the economic concerns. And I think they are much more, you know, in terms of person per space, right? Person per square foot, they have the lowest. And so they're the best, I think, suited to really move and continue to trend forward without much adjustment to how they would operate in both design or built environment. And they've already been making a strong push towards automation. So I think this is a world kind of designed for a second wave of an industrial revolution, largely based on the technology and how we communicate and how things are built and how things are shipped and transported. I'll pause there because I know we have some time for questions and I'd love to dive into those, but hopefully that was a good overview and some highlights of trends and things I've seen.
That was a wonderful overview, and you touched on every aspect that we were including in that. So thank you, Ed. And now,
Can I just say, let me just say something, this is not to ask a question, but to just give you a chance, Ed, to think about this so that I don't like spring it on you all of a sudden. I've been reading about modular construction, which has been used to do quick construction for healthcare workers and patients who need quarantining and all that stuff. But there are some people that say the fact, and shipping containers too, for say like isolating respiratory cases within hospitals so that they can just move these in, and it's a real flex. And you were mentioning, you put an emphasis on flexibility and design it. So I wonder, there are some architects who are suggesting that this use of modular in these emergency situations will actually introduce modular into more of a mainstream than has been in the past, particularly given the opposition of building trades and stuff like that, unions and things. So that's one thing. And another thing is what they're calling lightweight architecture, which is like tents, like the clinic, the medical clinic that's near where I'm living right now is using a tent for triage, but I know this is the California climate. But I'm wondering whether, say if retail does move outside, if it would be possible to do like pop-ups in tents during the more inclement weather months where they can't just be right outside and say the public square or something like that, but they need some shelter. So those are things, you don't have to talk about it now, but I just wanted to flag. Thanks.
And Eric has been doing just some research on some innovations in design and public space. So I'll turn it over to Eric.
Yeah, and Christine, I might be able to answer some of those questions too.
Good.
So basically what I'm going to talk about, let me get my notes here. I'm really excited to be on this panel, and it's really fun to have these conversations. I'm going to talk about a few ideas that are kind of designing and response to the pandemic and how to adapt our built environment. Oh, I'm sorry. There we go. So one thing that I think if you have a doorway to your business or your thing, like any entrance to any place, hands-free door opener. That's something that you can add to your built environment, that you can literally order one of these for $20 on Amazon. It's a simple solution that can prevent the spread of germs and limit contact with high-touch surfaces. So it's like simple solution that can really make a big difference, I think, in the future of spreading disease and things like that. One thing that our city specifically, the city's Slow Street initiative is a popular, it's a trend that we're seeing in Nashville as well as many other urban cities around the globe. And Metro has literally taken to the streets to provide additional outdoor recreation space in 8 Nashville neighborhoods right now. And this has resulted in 4.5 miles of closed roads to through traffic in a lot of neighborhoods. So giving other opportunities for outdoor spaces. Working at home and social distancing practices have resulted in less cars on the road. But because of reduced congestion, vehicles are driving faster in neighborhoods. So as a result, we have a lot more accidents per cars on the road than before the pandemic. This phenomenon is exposing poor roadway design and further disenfranchising our most vulnerable populations. And those are the people who really need good walkable infrastructure to get to public transit and other means like that. So we really need to keep encouraging Metro to try things like these Slow Street initiatives. I also want to talk about some other strategies that I've just seen from other cities. Even transit ship has dropped since the pandemic started. Many essential workers are still using the bus, and it might be their only means of mobility. So I would advocate that we should try pop-up dedicated bus lanes, which have successfully been implemented in Boston and DC, and then move to a long-term installation. And transit's oftentimes tied to economic productivity, and we should consider how to improve Nashville's transit system by analyzing areas that could be used with pop-up bus lanes. There are ideas like that to help combat the recession. This is something that was a direct response to the increased biking demand in New Zealand after they announced the COVID-19 lockdown. So I'll come back to this, but I just wanted to bring it up as another kind of transportation option. This is kind of maybe along the lines of what Christine was talking about. This was a proposed idea for outdoor markets as a response to social distancing in Rotterdam. there's less risk of person-to-person transmission in outdoor environments, and we should start thinking about shifting more commerce in outdoor areas. So this is kind of a diagram they came up with that shows the spacing grid that's kind of on the ground in one of these outdoor markets. So similar strategies have been used really around the world, but just even in public plazas, this is one from Italy with the white squares that is done in removable paint that can shows how people can navigate safely around the plaza, just giving you an idea of what that safe distance is as you're moving through. And then the one on the right is Domino Park in New York City. The Parks Department laid these white circles showing where it was safe to kind of lounge and reach out and be safely in public. So back to this bike lane idea. We've actually already done things like this in Nashville, and I wanted to highlight some of the work we did on Parking Day last year with Walk Bike Nashville. They implemented a pop-up bike lane on Commerce Street near our office, if you're familiar with it. And this is what they did is popped up a temporary one. It led to the permanent installation that is there today. And this is a strategy we call tactical urbanism. And this year we'd like you to participate with us on Parking Day and get involved with some of these tactical urbanism strategies. So Parking Day was created in San Francisco in 2005 by a design group who wanted to exhibit tactical urbanism ideas in parallel parking spaces. It now happens in hundreds of cities around the world. Usually, the Civic Design Center organizes hundreds of people to build what we call parklets all over town to exhibit creativity and advocate for public space on the third Friday in September. This year, we're changing our approach a little bit to adapt to social distancing guidelines. On the left is a photo I saw of 5 Points Pizza with a T-Rex waiting in line to order a pizza. But if you can see on that photo, the social distancing delineation markings on the ground, it takes up a large amount of the sidewalk. And this is already a crowded area, not in these times. And then you add those measures to it, and that makes it a little more complicated to move through. So then on the right is a photo from 2018. That was Hawk and Partners Parking Day installation. And it happened to be right there outside 5 Points Pizza. So this year for Parking Day, we want to encourage parklet builders to think about identifying areas with businesses like this that could benefit from Parking Day installations. Over the years, we've been leading Parking Day in Nashville. We've been working with Metro to formalize permitting long-term parklets that are more than just Parking Day. And if partnerships between businesses and parklet builders are identified, we can work with them to install these for longer than just a day period. So we start this whole process in July at an event called Skyline Social, which is the Civic Design Center's annual Parking Day kickoff party. Parklet builders will basically select parking spaces on that day to coordinate with the city to reserve spots for Parking Day. So we hope you'll join us in July for Skyline Social. I hope I left some time for questions in the end there, but I tried to get through it.
Thanks, Eric. And thanks to everybody. Christine? You want to go ahead, and I've got
You have some questions waiting that you want to, what do you got? It may overlap with some of my stuff.
Well, we did have a question here. Hold on, and I've lost my chat box. So go ahead and get started.
Okay. One question that I posed to the panelists this morning is there's a lot of discussion of the creation of more open space within cities for recreation, social distancing, outdoor dining and retail, alternative transportation, all the things we've seen people talk about this evening. What will the open space, well, first of all, where are we going to get the land for this? Are we going to have to adaptively reuse something, or are we going to tear something down or whatever? And then what will this open space look like with regard to such elements as urban forest, hardscape pathways, et cetera? I mean, do you think that people will still have the same desire to gather tightly together, or is there going to be more of an impetus to do a more meditative, more passive use kind of approach to some of these spaces? But particularly, where are we going to get the open space?
So I'll jump in here, and I
Okay.
think it's largely going to be some of the same concepts that we've seen before. You know, everyone looks at a parking lot as probably the most underutilized piece of property in terms of design as well as use. And I think, you know, when you start to have more and more areas where surface parking is present, but also not necessarily needed, you're starting to talk more and more about having certain streets closed and controlling the flows of traffic. Very not dissimilar to what we are seeing in grocery stores. We don't let you go one way. That was a concept that was pitched a little bit of a while ago. We were doing when we were in LA, and we were talking about their parks, and they were saying, you know, they're thinking about having the ability to expand some of their parks that are kind of in really tight areas. Is you close off one lane of each perimeter street, and you just make it be one way, and the park kind of expands. So I think, you know, whether we look at the streets and or parking surfaces or underutilized spaces, which I think time will tell as we start to evolve into what our new normal is, I think there just needs to be a strategy around reclaiming those and utilizing them. I also think that, you know, the example that Eric shown about Domino Park, it actually came up in the conversation we had about in Toronto's reopening. It was part of a bigger conversation, but focused on Toronto. We were supposed to go there for the spring meeting of ULI, and we weren't able to. So we've been having virtual sessions. And one of the things that they highlighted Domino Park as a way of saying we should be very active from the public sector. We should be very active in guiding the public into the things that they're safe to do and that we encourage them to do. I think that's going to be a big part in terms of not just design, because when you start talking about changing infrastructure and changing the way things are laid out, those can become capital cost impacted. And we've already heard from Leslie, I think she said it very aptly, every single municipality is going to be impacted in some way, form, or fashion. And they aren't going to be impacted in a positive manner. They're going to have tougher times paying for things. So utilizing things like chalk, paint, and things that are removable, because I think there's a certain psychology to this, and that's what came up on the call in Toronto. There's a certain psychology to people wanting a pandemic type state to be temporary. You don't want people to be depressed. You know, I think a lot of the things that I've talked more and more about have been less about economic health, but also about the social and mental health of people not being able to interact with each other, or the lack of hope of a brighter day or a brighter tomorrow. And I think the public's going to have to use our human capital and our human nature to really create spaces and make people feel welcome in things that we might not have seen as a public gathering space before. It's time to turn those things into that. And I think that's why, you know, Parking Day being highlighted is a great example, but I think we're going to have to take it a little bit further than just the public right of way in certain realms. We'll have to work with private property owners as well as quasi-public entities and public entities to say, how can we make this something that's appealing to private entities to engage in? And I think once you get a few models and you find a way to make it economically viable, the private sector will catch on, but I think the public sector will have to lead that just a little bit. Okay.
Gary, do you want to ask some
Yes.
online questions?
I've
got some others, but I can, you know, whatever.
Yes, and we should have planned more time for this. So I'm asked the panelists if you're capable of staying on for a little bit longer. We'll continue the Q&A, so we just don't cut it off at 7. Mm-hmm. This, I think, is for probably Dr. Ariola and Ed maybe could provide some insight on this. From the map that I showed in my portion of the presentation, Dr. Ariola, which I know was created in partnership with the health department. This question is from an attendee. Are the communities affected most by COVID-19, whether that's zip code area or otherwise, the same communities that were largely shown in that map with health inequities. I don't know what type of mapping, and also I know you're not currently at the Metro Public Health Department, so I'm not sure if you've been following that from us, but Leslie, you may have insight on this as well. Are those communities that we're mapping with, or is it really just everywhere? Because as Leslie said too, it's impacting everyone. So is there a physical mapping process that's going on that's looking at the city geographically to where this is happening, and how, if any way, are the connections there with maybe the lower income communities and neighborhoods across the city?
So I have followed Nashville's response and data, but not to that level. But I would say with COVID-19, it is everywhere, and I think in terms of transmission, it's probably going to be higher in some places based on proximity, density, and people interacting. But I think the lesson to live here with, it's everywhere, and you can catch the infection anywhere. However, I think what you will see that will be largely different is the rate of adverse impacts, and that again is what is more likely to be correlated with being insured, access to healthcare, and all of the other stuff. So, but I can't speak to Nashville data. Maybe Leslie and others can. Yeah.
What I can say about the response is one, in some ways it's hard to know because we don't have testing for every single case out there. And so it's hard to get a complete picture or comprehensive picture on what's happening. We do know that we typically have more cases in urban areas than we do have in rural areas, and that's simply a matter of population. We are doing targeted efforts as a state for vulnerable populations. So we've done some messaging for minority and immigrant communities around the importance of practicing safe health practices, getting tested, things like that. There are a lot of populations that have a fear of getting tested. For those who are not US citizens, there's a fear of deportation, things like that. And so we are focused right now on, you've heard a lot about nursing homes, heard a lot about jails and prisons. So we're focusing a lot where we know we have known high concentrations of vulnerable populations. And then now we're turning our attention to outreach efforts for other populations like those I just mentioned. In terms of the mapping, I don't know. Like Dr. Areola, I haven't followed Nashville specifically to look at how much they've done in terms of mapping. But I would think that we're going to start to see some patterns and trends, particularly as we get more data. One thing, of course, that we're concerned about is some folks are not seeking healthcare because they are afraid of contracting COVID, when in fact they may have COVID, and maybe they're not seeking care soon enough. And so it's very hard for us, for example, to look at the deaths that are coming through the state that may look like they're attributable to another cause and may in fact be related to COVID-19, but we don't know because that person never sought treatment or testing for COVID-19. So the data piece is a little bit tricky right now in terms of getting a comprehensive picture.
Yeah, Gary, you had called on me, and again, the one person answering that is not a healthcare professional. So I'll put that disclaimer out there.
So the second part of that question, though, is and I've seen a couple articles on obviously like people who are renting and with the economic impact of maybe not having or being laid off and the wave that's happening with people potentially being evicted from their housing, as well as I think it's fascinating too, because especially in Nashville, we had such a tourist economy and the Airbnb market being here so strong that there seems to be a lot of housing that's coming back onto whether that's for sale or for longer term rentals. So I don't know if there's anything happening in the city that can try to recapture some of that housing, as well as policies that can keep people in their homes so that they can't be evicted during this time.
Well, and the other thing that I don't know if I mentioned any place else or before, but the other thing in terms of affordable housing is there's been a lot of discussion in Los Angeles and San Francisco out here in California about there's an assumption that there's going to be more working from home and there will be less of a demand for office space than has been in the past, particularly in the San Francisco because of the techiness of it all. But there's been a lot of talk about the possibility of repurposing existing office buildings for affordable residential, not just high-end condos with great views of the Golden Gate or something like that. And I just wonder how hard that is to do. I know the floor-to-floor ratios can be different, but I don't know.
Yeah, I think, well, a couple of things there. I think one, there has been pretty much a nationwide mandate for some time that people weren't able to be evicted or removed. It's actually been quite a challenging conversation. I don't think it's talked about a lot for people who are property owners, who have tenants that are renting, that aren't the more mega corporations or conglomerates who have, thousands of units. But the people who are more small town, they own 5 to 10 or maybe 20 or 30 units, whether it be duplexes, single family, or a multifamily. And they're not able to collect rent from their tenants, but they're also not able to evict them, which I believe is the correct approach in this case, right? They shouldn't be putting people out. But the challenge is that unlike with the PPP, which was based on individuals and or supporting small businesses so that they keep employees, you don't have really a program in place to support those businesses that are real estate investors and landlords. And so there's been a lot of chatter about what does that mean. To Gary's point, I think, the way to do that is to potentially look at listing properties for sale, for somebody who can take on a property that is occupied. They don't care to put somebody out because they may not be able to. But those types of transactions are taking place, as well as looking at what does it mean for housing. I think a little bit of a knee-jerk reaction and happened when Airbnb conversations about what areas, what type of properties, what type of zoning wouldn't allow Airbnb non-occupant rentals. And you saw an influx of housing kind of hit the markets in certain zip codes and certain areas because they had been built based on the concept of being able to rent them out that way. I think some of what's happening now is a similar response. And I agree with you, Gary. I think it's a trend that we'll continue to see the longer things that stay where they are. To the question that Christine asked, that's been a conversation quite a bit about those skyscrapers, right? All of that square footage. What do you do with it when nobody's going to commute there for work? There has to be a use for it other than it being vacant. I think that is going to largely play economically on what people can figure out in terms of, is there a way for that to be written off in some way, form, or fashion? I think there'll have to be some pretty significant incentives around people who own something privately to convert it. The cost of converting it or the cost of letting it go will have to be broached before I think those properties can become modified to support units. Can they do it? Yeah, I think so, especially in some of the larger skyscrapers. I mean, the floor-to-floors might be a challenge, but I mean, if you can take old factories that were operating in the late 1800s and make lofts out of them, I'm pretty sure you would have a problem getting people to find a way to adjust a skyscraper that has a great view of any type of skyline and or bridge or natural feature like a river or mountains. So the possibility is there. I think it's a like most real estate development, it's an economics question.
Okay. What else do you have, Gary?
Well, I think this is certainly an equity question, and it's not something. Well, yeah. So, on public space usage, and this is actually somebody that's asking about: are there ways to address built environment to mitigate some of the risk of enforcement police presence for people of color that they're experiencing related to inequitable policing practices regarding social distancing.
Yeah, well, I will of course let other people talk, but I think the most in-depth conversation I've had about this in terms of practicality was again in Austin, and we were talking about their the trail. So they have the Lady Bird Lake and the trail around it, and it crosses and traverses different parts of the city. And one of the challenges that they had there was you have this trail that encourages people to run it for a great purpose, a great cause. But because of that, you have people coming from different communities, different backgrounds. They're starting to interact and engage each other. And, you know, certain types of people do different things. And you have the desire to be expressed for connectivity and to connect the trail, which it is somewhat segregated, just physically. You can't, it's not all the way connected. But there are certain parts of town that are historically African-American or historically Hispanic, where the use of the trail and the use of that park has not been for trail-related exercise. It's been used for picnics and cookouts and graduation parties and things of that nature. And so people running and having dogs is not necessarily the same as the use of that community. One suggestion there, and it's not necessarily a design suggestion other than putting, you know, more signs up that say leash laws are in place and leashes must be X long. It's creating and requiring the public realm to adopt community officers for the police department and or parks department, and that they set initiatives for people that are working in those locations to look like and speak the languages and to be community members there, and trying to show the community that there's a definite commitment to that is kind of one of their top priorities. It was more of a conversation about the community centers, right? The access to them and making sure that they are culturally appropriate for the types of activities that they want to have happen. But it did spill over to the trail, which is essentially, you know, a paved trail, and then you have a lot of open space. But how do you regulate that open space for the use of the community, and who is deemed as the community? So I think, you know, more so than design, I think it's more facilitating conversation. And again, the public realm and the public sector taking responsibility for that space and for the delivery of a good that is intended for the people of that area. It has to be done, I think, with the people approach and not necessarily designed out. I mean, you can put the most beautiful thing or the most grotesque thing there, but human interaction has to be managed and mitigated in certain ways.
Yes, thank you. Anybody, Leslie, I know you're a biker, opportunities for increasing bicycle. We have a question about the rise of electric bicycle industry. Any thoughts or I guess big dreams on that?
Oh, big dreams. I have big dreams. I think what we are seeing in our larger urban areas, and this, Christine, gets back to your question about mass transit, is in some large cities like New York, Chicago, what we're seeing is a limit on the number of folks who can use mass transit at a time. And so some of the shorter distance trips, the 1 to 3 mile trips, are now being taken by bicycle or walking or another micro mobility mode. We are seeing bike sales go through the roof all across the country. It's unprecedented, the number of bikes that are being sold right now. It'll be interesting to see how many of those are being used solely for transportation and how much is being used for recreation or a combination of the two. And so I think we're going to continue to see folks who are using other mobility modes, particularly when the weather's nice like it is now. We're getting into the spring and now the summer months. It'll maybe different over the winter, but we're definitely seeing a mode shift. And I think time will tell if this mode shift stays or if we're going to be reverting back to more of the single occupancy vehicle travel where folks feel more comfortable. So I think the future of rideshare and the future of things like scooters where you're maybe picking up a scooter, but you don't know who used it last or how long ago it was used. I think those types of commute modes are going to be adapting, and we've already seen rideshare adapting very rapidly with things like plexiglass in the around the driver and things like that. So we're going to see, I think, a lot of modifications, but that's great because we're creative, and so we'll see some really interesting solutions.
There's also been studies, just very recent studies I've read on areas around like interstate highways, but because of the increased air pollution there, the susceptibility of people living adjacent to that. And that certainly ties into equity and even back historically to the construction of the interstate systems. Any other thoughts on that? I mean, like, what potential could be done with that in the future? I know we're planning a future program on this topic at an urban design forum in the coming months, but I just want to throw that out for either Leslie or Dr. Areola, if you've seen any studies related to that.
Well, we're actually conducting a study right now with TDOT. So we are looking at a couple of different things. We're looking at transportation to cancer treatment across the state. And we're also looking at air quality in relationship to diagnosed cases of childhood asthma and proximity to high volume roadways. So it's an interesting partnership between the Department of Health and the Department of Transportation to combine data sets that traditionally aren't combined and see if we can't look for some causal relationships. So we're excited to be doing some of that kind of work in Tennessee.
Great. Okay, I know we're pushing the limits of going over our time here. So what I will say to people is, if we haven't had a chance to answer your question in the Q&A, we will try our hardest to get responses back to you from our panelists. And as we did with our forum following the tornado, we will come out with a follow-up email to this with the video link, as well as links and resources that have been identified by our speakers. So one final thanks to all of our panelists. Thank you so much for joining us. Thank you, Christine, for coming in from all the way in California.
It's hard.
And Leslie, I do want to, there's one final slide I want to share for everyone who's still online and for people who will be watching this later. If you're interested in learning more about urban planning and design, and particularly the socially conscious aspect of urban design and planning, which addresses and looks at things like equity and all aspects of the built environment and how to incorporate that into both current and future planning, we would like to invite you to participate in our upcoming Socially Conscious Design 101 course, which will be kicking off on June the 10th. And this will be, we had initially planned this as an in-person event, 8-week, 2-hour sessions each week on Wednesdays, which was supported by Hastings and was going to be hosted in their new office. But due to COVID, we have transitioned this to a virtual offering as a course. And one of our partner groups is the AIA Middle Tennessee, and we'll be offering 16 continuing education credit hours for architects who are involved and engaged with AIA, as well as a community educational course. So anybody can sign up for it. And obviously with COVID and a virtual platform, we can actually have greater access for attendees to that. So look forward to more from the Design Center. Again, it'll kick off on June the 10th. It's a 2-hour course every Wednesday from 6 to 8 for 8 weeks. And as you see, it starts with the history of urban planning and goes to vision planning and community engagement and community participatory planning, to transportation, land use, neighborhood development, public space and placemaking, and ends on activism and ways to get involved and be more engaged in the city. So thank you once again to everybody for for sticking with us to the end of the program, and look forward to further conversations, getting back to work as much as we can safely, but also being able to see everybody again. So thank you very much. Have a wonderful evening.
Bye.
Bye.